Dear students, welcome back. In this session, we are going to discuss about femoral nerve, which is one of the nerves of the lower limb. Femoral nerve is the nerve of anterior compartment of the thigh. Okay, femoral nerve is the nerve of anterior compartment of thigh. Its cutaneous branch, the saphenous nerve, extends medial side of the leg and medial border of the foot till the ball of the big toe, till up to the ball of the big toe. Okay, if you see the root value of this femoral nerve, the root value is from the nerve is arising from the lumbar plexus, the two dorsal division of the ventral rami of L2, L3 and L4 spinal nerves. Okay. Next, if you see this beginning and the course of this nerve, it emerges at the lateral border of the psoas major. So normally the psoas major is the posterior abdominal wall. So it emerges at the lateral border of the psoas major muscle in the abdomen. It passes downwards between psoas major and the iliacus. Psoas major and the iliacus muscle. After passing downwards between the psoas major and iliacus muscle, the nerve enters the thigh. The nerve enters the thigh behind the inguinal ligament. Here you can see the inguinal ligament. Behind the inguinal ligament, it enters into the thigh, and it is present lateral to the femoral sheath. It is present lateral to the femoral sheath, and it is not the content of femoral sheath. Okay. Yes. In the femoral sheath, it encloses only femoral vein and artery, but it is one of the content of femoral triangle. Okay. So once it enters into the thigh behind the inguinal ligament, it ends by dividing into two divisions 2.5 centimeters below the inguinal ligament. Below the inguinal ligament, 2.5 centimeters below the inguinal ligament, this femoral nerve divides into two branches. So this is the termination of this femoral nerve. Okay. And these divisions, these two divisions end up in number of branches. Okay, in between the two divisions, we can find a lateral circumflex artery, lateral circumflex femoral artery is present. Okay, so this is about the course of the femoral nerve. Now we will see the branches of this femoral nerve in detail. Okay, yes. Here we can see the branches. So what are the branches given in the abdomen, thigh, leg and foot? Now we will see. So in the abdomen, it gives branches to the iliacus muscle. Okay, and it gives a branch to the pectineus muscle, which passes behind the femoral sheath to reach this muscle. Okay, so in the abdomen, these are the two branches given by this femoral nerve. Okay, once it enters into the thigh, this is the thigh region. Once it enters into the thigh region, it divides into two branches below the inguinal ligament, that is 2.5 centimeters below the inguinal ligament. It gives anterior division and the posterior division. So in between these two branches, we can find the lateral circumflex femoral artery. Okay, now first we will see the anterior division branches. Okay, so it is having muscular branches as well as the cutaneous branches, muscular branches and cutaneous branches. So the muscular branch is sartorius and the cutaneous branches from the anterior division are the medial cutaneous nerve of thigh and intermediate cutaneous nerve of thigh. These are the cutaneous branches and muscular branches arising from the anterior superficial division. And some of the vascular branches which are also arising from this anterior division, that is some sympathetic fibers to the femoral artery is also supplied by this anterior division. Okay, if we see the posterior division, so it is having muscular branches, cutaneous branches as well as the articular branches also there. Okay, so if you see the articular branch, it gives branch to the hip joint. Okay, and it also gives branch to the knee joint also. Okay, these are the two articular branches. Okay, now what are the muscular branches? It gives supply to the quadriceps femoris muscle, which includes rectus femoris, vastus lateralis, vastus intermedius and vastus medialis. All these muscles are supplied by this one. And then it also gives rise to saphenous nerve. So the longest branch, cutaneous branch, which arising from the posterior division of the femoral nerve. And for the medial side of the leg, this one only enters into the leg region, medial side of the leg and medial border of the foot. Okay, so and this one only enters into the foot up to the great toe. Okay, this saphenous nerve gives some cutaneous branches to skin on the medial side of the leg, and in the foot also it supplies skin on the medial side of the foot up to the ball of the great toe. So these are all the branches of the femoral nerve. Thank you.